Hi, everyone. I'm Dr. Swanson alongside Dr. Magda from KSB Foot and Ankle, and we would like to welcome you to this evening's KSB Community Wellness presentation. I'd like to thank Aaron Fox and KSB for putting this on this evening. And we thought with school right around the corner, along with the fall season of sports, we wanted to talk about sports injuries and some preventative measures that we can take to help hopefully keep everybody as safe as possible. So topics we would like to cover regarding sports injury specific, ankle injuries, high ankle, Achilles, and various foot injuries. And then we'll get into some exam findings and what we see in the clinic during our evaluation. And then treatment options, both conservative and surgical if warranted. And then we'll wrap it up with some preventative measures as well. So I'd like to turn it over to Dr. Magda this time, and she'll get started with ankle injuries.
Hello, everybody. My name is Dr. Magda. So we're going to start with ankle injuries, like Dr. Swanson said. So ankle sprains can happen with a twisting injury. It's when you land on an uneven surface, multiple ankle ligaments can be affected. A high ankle sprain often involves the ankle syndesmotic ligament, which is really important in holding both of the bones in our leg together. So this is between the two lower leg bones, the tibia and the fibula. Ankle fractures can be isolated to one ankle bone or multiple ankle bones, depending on the severity of the fracture. They can be closed versus open. Open fractures can have a break in the skin, which can be very dangerous. Associated injuries include the foot, the knee, the hip, and the lower back. Achilles injuries are often common and can also include Achilles tendonitis, which can be due to trauma, calf tightness, pain along the tendon or the heel, as well as thickening over time. This can be a chronic condition known as tendinosis versus an inflammation, tendonitis. The Achilles often ruptures in this area that we call the watershed area. It's 2 to 6 centimeters from the heel insertion, and oftentimes there are less blood vessels in that area, causing it more likely to be ruptured, as you can see in the image here. Foot injuries can often occur with sport. There are multiple bone, tendon, and ligaments in our feet, as you can see in the x-ray here. In the midfoot, there is a ligament that helps hold our foot together. It's called the Lisfranc ligament. And oftentimes, if that gets damaged, surgery may be necessary because it's such an important ligament. It helps support and hold our arch. In the toe, there's also a condition that can be called turf toe. That's very common among athletes who perform on turf. Different foot fractures can include toes, fractures in the midfoot, as well as fractures in the hindfoot. So when these injuries happen and patients come to our office, we look at different exam findings. So for sprains and fractures, typically we're looking at pain, bruising, swelling, and a possible deformity that could let us know what's going on. It's also important for us to see, is the patient able to bear weight? If it's an open wound, there is an emergency with an associated fracture. For foot and ankle instability, we also examine. There could be possibility of chronic sprains, and then this also increases the risk of future injury. So with foot and ankle instability, we like to try to combat the loss of strength, flexibility, and proprioception, which is another word for balance.
All right, thanks, Dr. Magda. So, when should you go to the emergency room? Well, whenever you notice a foot or ankle deformity, an open wound like Dr. Magda talked about, especially when there is a broken bone, when you have severe pain, if you are unable to bear any weight on that lower extremity, or if you're concerned of any other injuries, whether it be lower back, your head, or if you did lose consciousness. So into treatments now, conservative measures include protective weight bearing. This may involve one of those devices called a cam boot or the black boot that's on the right-hand picture, a short leg cast, or even a posterior splint, which is like a half of a cast. A lot of us have often heard of RICE therapy, which includes rest, icing, compression, and elevation of the extremity. That can be helpful. Minimizing your activity different type of ankle bracing and taping techniques. Supportive shoes and inserts can always be helpful as well. And then we have an outstanding physical therapy department that we work alongside, and they can provide services as well to help get patients back on their feet. Surgical treatment. So when surgery is warranted, we often refer to this as open reduction internal fixation, and we use a variety of materials to fix these injuries. We can use plates, screws, K-wires, which are like metal pins, and then even a device called an external fixation device. And that is pictured on the left-hand side there. That will be a temporary fixation, and then later we do another procedure with more definitive fixation involving plates, screws, or pins. Preventative measures. So supportive shoe gear and inserts is always helpful in supporting our lower extremities, and that also helps the joints up from there, meaning our ankles, knees, hips, back, shoulders, all the way to the tip of the head. Warming up before activities and stretching, I do have that underlined. That is extremely important. So we recommend stretching before activity and after as well. And we do recommend 3 to 5 times stretching during the day if possible. Rice therapy, like we mentioned. And then addressing any underlying imbalances, whether it be with strength, flexibility, or proprioception or balance. Well, good. Well, that concludes our presentation this evening. We hope that you enjoyed it. And once again, thanks to Aaron Fox and KSB Community Wellness. If anybody has a question, I'd be happy to post it below and I will get back to you. If you have any questions or concerns or feel you have suffered an injury or like to have an evaluation in our podiatry clinic, we would be more than happy to set up an appointment and take care of you as well. So we hope everybody has a great start to the fall season of sports and school year. We'll see you next time. Thank you.